is closely related to the losing weight to reduce neck fat accumulation, which can reduce the collapse of the upper airway, thus improving airway stenosis. Second, change position. When patients sleep in supine, the tongue base will fall back and collapse due to gravity. Raise the head of the bed and sleep on side can reduce the obstruction of the upper airway. Third, is closely related to the losing weight to reduce neck fat accumulation, which can reduce the collapse of the upper airway, thus improving airway stenosis. Second, change position. When patients sleep in supine, the tongue base will fall back and collapse due to gravity. Raise the head of the bed and sleep on side can reduce the obstruction of the upper airway. Third, quit smoking and drinking. The components of alcohol can make the muscles in the throat become too relaxed, causing airway collapse. Fourth, treat the cause and correct it. The basic diseases that cause or aggravate OS, such as hypothyroidism and so on. If the above methods have no obvious effect, you need to consider non-invasive airway, positive airway pressure. See first-line treatment for patients with moderate to severe. The principle is it provides a stable pressurized airflow to keep the upper airway unobstructed, to ensure the delivery of oxygen, to improve the patient's hypoxia and sleep quality before use. You need to consult a doctor to confirm no pressure titration. Set the most suitable pressure. So, how can we choose a ventilator? First is effectiveness. At different stages of sleep, the same patient, the required pressure is different. Abnormalities during sleep can be roughly divided into snoring, hypoventilation, apnea, and so on, according to the causes, can be divided into obstructive and central. An excellent ventilator needs to accurately identify the above. Accurate identification, and on this basis, have a reasonable automatic pressure strategy. For example, obstructive abnormalities require timely pressure rise. Central apnea requires avoiding pressure increase. It needs to avoid pressure, and the output of airflow should be consistent with the patient's breathing rhythm. If the response is sluggish or sudden, or unstable air flow output may affect the treatment effect, or even worsen it. A good home ventilator can use more intelligent algorithms, improve the quality of human-machine breathing, reduce discomfort during the initial wearing. Secondly, comfort, although ventilators, but it may also have side effects. For example, during the process, may increase water evaporation, causing dryness of the respiratory mucus, causing dry mouth, nosebleeds, or sore throat. So many ventilators warm and humidify to be heated, and humidify to provide a more comfortable experience. But also note that if the temperature, such as excessive condensate may form in the pipeline, which will affect the user experience. Meanwhile, the mask of the ventilator will also affect the experience. If it's too tight, it will press, and too loose may cause air leakage. So it's best to choose adjustable. You can choose a flat mask according to your needs, or one that can wrap around.
I'm using a CPAP machine made by Taikangin in China. This CP dual-level CPAP machine. This one is the most cost-effective. Look, this small water tank is for water, which humidifies and heats the air in the pipeline, and heat, which can avoid symptoms such as dryness and bleeding. The noise is very low, or even negligible, because you can't hear it. After all, it's so enjoyable. The most important point is that through AI algorithms, let the machine adapt to your physical condition. The most important point.